Pay attention to this information. This information is very, very important because it will be assisting those who need it. The conditions that will make you to remove your fibroid. The conditions that will make you to seek surgical attention for your fibroid. Now, it is not all fibroids that will require surgical removal or that will require treatment, but there are some conditions that will make you to remove your fibroids. I will be telling you these conditions, so I need you to pay keen attention to this information. Number 1, your fibroid must be symptomatic. What do I mean by your fibroid must be symptomatic? There must be symptoms coming from this fibroid for you to start thinking of its removal. Without symptoms, there's no point going to have fibroid removed or even seeking any form of treatment for the fibroid. The reason is that most women, 6 out of 10 women would have fibroid, so it is not every fibroid that you seek for treatment or that you go for fibroid surgery. No, when it becomes symptomatic. So what are those symptoms that will make you to go and have fibroid surgery? Number 1, when you start having what is called menorrhagia. Menorrhagia is heavy menstrual bleeding. Every month your menses becomes heavy, so heavy that it comes out in clots. You use many pads, many rows of pads. You become dizzy at the end of your menstruation, or even while you are menstruating, you become dizzy. You need to have blood transfused and all that. You do it this month, you do it next month. Almost every month you are having heavy menstrual bleeding. If you have fibroid and you are experiencing this condition, it requires treatment. Okay, that's number 1. Number 2, if you have fibroid and you are having severe pains, unbearable pains, you use NSAID, whether piroxicam, whether cataflam, whether any other form of diclofenac, but every month you are using NSAID in order to control pain. You have fibroid. It is time to receive treatment for your fibroid. That is number 2. Number 3, if you have fibroid and you have recurrent miscarriages. Recurrent miscarriages is when you lose pregnancies, especially in the second trimester. After the first 3 months and between the first 3 from the 3rd month to about 28 weeks, you lose pregnancy, and you keep losing pregnancy. Every time you become pregnant, you lose it. Every time you become pregnant, you lose it, and you have fibroid. If there is no other cause for that pregnancy losses, then it is time to treat your fibroid. Remove it. It may be responsible for your pregnancy losses, especially when it is a submucosal type or intramural type, it may be responsible for your pregnancy losses. Okay, now if you have, that is number 3, if you have fibroid and your fibroid has grown so large that if anybody sees you, the person feels you are pregnant, you look pregnant whereas you are not pregnant, and you have fibroid, and fibroid is responsible for that, it is time to treat it so that you cosmetically you look well. When someone sees you, you look like a normal person. Okay, so if you want to, if it's been making you to feel somehow, you are beginning to feel psychologically unwell, because you are not pregnant but people see you and feel you are pregnant, it is time to remove your fibroid. Now if your fibroid is so large, and because of that it makes you to have what we call pressure symptoms, it makes you to have frequency of micturition, you urinate frequently, and occasionally it can even make you not to even urinate. It can make you to have urine retention sometimes. Now these features are very important because they are worrisome and they can disturb you so much. It is time to remove that fibroid if you are having these pressure symptoms. Okay, so now having said this, whenever a diagnosis of fibroid is made and you are having these symptoms, it is time to go and remove those fibroids. Okay, and remember, like I said earlier, it is not all fibroids that are treated. It's once they become symptomatic, once they start giving you these symptoms that I've mentioned, you need to treat them so that you have quality life. All right, please, if you enjoyed this message or if you benefited from this message, kindly help us to share it so that other people can also listen to it and benefit from it. Thank you and God bless.